designed to capture X-ray light. From bitewings wide to PAs tall, we read the roots, we see it all. Bitewings show those crowns so near, interproximal decay is clear. Periapical, go to the bone, infection, fracture, all are shown. This is part of Dr. Jany's lecture.
It's a radiograph rhapsody, shadows in gray, landmarks whisper what he can't say. Carries his canal so deep, with just one click the secrets leap. Know your types and check technique, one wrong angle and it's mystique. This is no guess, this is no plea, it's image-based diagnosis mastery.
Mental foramen round and low, below premolars don't you blow. Don't call it a lesion, know the map, or you'll misdiagnose the radiograph. Inferior border mandibular line, opaque and smooth, it's by design. Maxillary sinus crescent high, clouded views, infection might lie. This is part of Dr. Jany's lecture. Zygomatic arch coronoid too, they sneak in shots, confuse the view.
It's a radiograph rhapsody, knowledge by light, a grayscale guide through bone and bite. Know your normals, know what's new. Every pixel holds a clue, from lamina, dura to PDL space. Clarity leaves in contrast in place. Panoramic wide, occlusal bold. Radiographs let the story unfold.
ALARA rules as low as we can. Protect the patient, follow the plan. Lead shields on, exposure low. Digital films, the way to go. Beam alignment sharp and neat. Parallel technique. Repeat. Repeat. Too much cone cut, fix your track. Check your rings and get on back.